The On Control power driver is a mechanical device that enables us to perform a bone marrow biopsy, taking our samples the same as we would with a manual driver, but giving us the better quality samples, a speedier process, and a much more comfortable procedure for our patients. If I got a tired tap while I was doing the bone marrow biopsy, it may well be that because of the disease or the nature of the person's diagnosis that there literally isn't a possibility of me getting an aspirate sample. However, I would have to check and make sure that I was actually doing the procedure in the bone marrow and I wasn't having my needle still in the cortex, the harder part of the bone. So I might put my pointed sharp needle back into the hollow needle of the driver and manipulate the needle to go either a little bit further or to pull the needle back to see if I can get my sample. If I still can't get an aspirate sample, I would do what's called a trephine roll. This involves taking the actual trephine sample you get, the piece of bone, when you do the second part of the procedure. Instead of decanting the piece of bone into the bone marrow sample pot, you would decant it onto a slide, take a second slide and place it on top of the trephine sample and literally roll the trephine along the slide. This should give you some sample particulates that you can use to look at under microscope at the lab. Sometimes you might get some clotting between the aspirate and trephine samples when you're taking your bone marrow biopsy samples. At our hospital, we don't actually put anything into the hollow needle to prevent this from happening. What we would do is we would take out our trephine sample and again decant it onto a slide rather than straight into the specimen pot. When you do this, you're able to cut off the little piece of clot that's attached to your trephine sample and then put the trephine sample into your specimen pot. The key factors of moving from our consultant-led service to a totally nurse-led service was that it gave us a much more efficient procedure, made our patients much more comfortable for something that's quite a painful, invasive procedure. When I use the driver, I want to make sure that I don't put too much pressure because I don't want to be forcing the drill into the bone. I want to maintain a steady pressure so that I can control the movement of the drill so that when I feel the give, when I've gone through the cortex, I'm able to immediately stop. If I don't feel the give when I'm accessing the bone marrow sample, it may well be that I'm not quite in the right position. So I would again put my pointed needle back into the hollow needle and manipulate the needle slightly forward or slightly back just to change the position slightly to see if I can get an aspirate from there. I might well have to use my experience to think that the cortex is a very small, few millimetres in width. So therefore, if I push my needle in and I'm now at a centimetre, I've gone too far through and I might need to pull my needle back again. I can access the bone manually using the needle from the driver before I attach the driver. Sometimes when our people are training, they're much more confident, having used the manual technique to start with, that they will actually use the needle on its own to get to the cortex of the bone and then attach the driver to do the procedure. If I'm using the On Control driver, I don't have to change the way that I do the bone marrow biopsy at all. It's exactly the same procedure as a manual procedure, just with a slightly different piece of equipment. Our driver biopsy needles come in two sizes. The gauge is 3 millimetres. One of them is 102 millimetres in length and the other one is 152 millimetres in length. If the sample gets stuck in the needle after you performed your bone marrow biopsy, the recommendation is that you place the white plastic piece on top of your hollow needle and you take the blunt needle, insert it on the top and give a firm tap to dislodge the piece before you try to push it out. The driver will normally do around 60 to 80 procedures. It's important to make sure that you check the battery before you start the procedure. It will flash green when there's enough battery for you to use the driver, but the colour will change to orange and then to red if the battery is dead and you need to change to a new driver. All of our nurses in our nurse-led bone marrow clinic work on their own whilst they're doing the procedures. Using the driver has not made this procedure any more complicated. It's made it much more efficient for the nurse concerned and has enabled us to introduce many more procedures for that one person to do on their own. After the completion of a biopsy, we ask a patient to wait for about 10 to 15 minutes. During this time, we will usually be labelling our samples ready to send off to the lab. Before the patient leaves, we will then check the biopsy site to make sure there's been no bleeding or oozing through the dressing, and then they're free to go. If a patient is on blood thinners prior to their biopsy, the team and nurse performing the biopsy should be informed. The team concerned should arrange for a bridging plan so that the patient either has to stop their anticoagulants maybe the day before that they come in for the biopsy to restart the following day. but each one should have a tailored individual plan. If it's something like a maintenance dose of aspirin, around 30 milligrams, then we would not bother to stop that, and we would just continue straightforward biopsy. To put a patient at ease over the use and noise of a power driver, we always make sure that we run through the whole procedure with the patient prior to starting the biopsy. If the patient is particularly concerned, we also make sure that we let them hear the noise of the driver before we start the procedure, so that we know when we tell them it's about to happen, it won't make them jump or to be afraid. The major advantages of using our powered driver is it enables us to increase our patient numbers. Our labs are very happy because the samples that they are receiving are of a better quality than they are when performed with a manual biopsy needle. And in terms of patient comfort, the feedback we get is that it's a much more comfortable procedure using the driver, and people actually ask to have the driver rather than the manual when they come in for a bone marrow biopsy. And for our users, it's a much more comfortable, quick and easier piece of equipment for them to use.